Hi, everyone. Thank you for joining us. We will begin the webinar in just about 2 minutes. Okay, we'll get started. So hi, everyone. Thank you so much for joining us today. My name is Haley. My pronouns are she and her, and I'm a project officer with CPHA's Substance Use Project. I'll be moderating the webinar today along with my colleague, Karen. While we are working remotely, I would like to acknowledge that CPHA's office is located on the original unceded territory of the Algonquin Anishinaabe people. They have been the guardians of this land for millennia, and CPHA is grateful for the example that their stewardship provides. CPHA is committed to working with First Nations, Inuit, and Métis peoples and their governments in realizing meaningful truth and reconciliation. So now for a bit of housekeeping. All participants are muted, but we hope to engage you throughout the webinar through other features. If you have general comments, please post them in the chat box in the toolbar at the bottom of your screen, visible to all participants. If you have questions for the presenters, please post them in the Q&A box, which is visible to all presenters. The format for this webinar will involve a presentation followed by a question and answer session at the end of the webinar. If you think of any questions during the presentation, please drop them in the Q&A box and we will try to get to them all in the last several minutes if possible. This webinar is being recorded and the recording will be made available on CPHA's YouTube channel shortly after the webinar. So once again, thank you so much for joining us today for this webinar entitled Gender-Informed Virtual Interventions Addressing Substance Use and Intimate Partner Violence. This webinar will describe technology-based approaches in substance use prevention and health promotion. It will include information on how technology-based interventions can address sex, gender, and intersectional equity considerations. This webinar will draw upon a scoping review on sex, gender, and substance use, as well as a rapid review on interventions for intimate partner violence and substance use in the COVID-19 pandemic, both undertaken by the Center of Excellence for Women's Health. This webinar will offer ideas for how service providers, researchers, and policymakers can act on incorporating gender equity as a method for improving health outcomes. And now we will introduce our three amazing presenters. So Nancy Poole is the director of the Center of Excellence for Women's Health and the lead on a number of research and knowledge translation projects related to alcohol, other substance use, trauma-informed approaches, and Indigenous wellness. Nancy's doctorate was on the topic of using virtual communities to bring multi-sectoral participants together to discuss and plan action on wicked problems. Julie Stinson is the Research and Knowledge Exchange Coordinator at the Center of Excellence for Women's Health. Julie is responsible for assisting with research projects related to sex, gender, and substance use. She also manages the center's online presence through the website, social media, and other knowledge exchange opportunities. Lindsay Wolfson is the manager at the Center of Excellence for Women's Health. Lindsay is responsible for research and collaboration on projects relating to Indigenous health and wellness, fetal alcohol spectrum disorder prevention, and the integration of gender, trauma, culture, and equity-informed approaches into policy, research, and practice. Thank you to our three amazing presenters for joining us today. And now I'll turn it over to Nancy, Julie, and Lindsay for the presentation.
Thank you so much, Haley, for that wonderful introduction. Before we begin, we just wanted to acknowledge that we are gathering here today from diverse lands across Turtle Island, and we will pay our respects to elders past, present, and emerging of the lands in which we work, live, and play. Julie and I are joining you from the traditional territory of the Wendat, Anishinaabe, Haudenosaunee, Métis, and Mississaugas the New Credit. Nancy is standing on the traditional territory of the Lekwungen-speaking peoples, including the Songhees, Esquimalt, and Wasanich peoples. We at the center continue to work to uphold the 94 calls to action provided in the Truth and Reconciliation Commission 5 years ago, and work towards the 231 calls to justice outlined through the Missing and Murdered Indigenous Women and Girls inquiry.
So I'm going to start off. This is Nancy, giving a bit of background on some sex, gender, and equity concepts in substance use and a framework for gender-informed approaches. Lindsay's then going to give some examples of technology-based approaches that to sort of ground us in this whole concept. And then Julie's going to spend some time talking about the findings about bringing those things together of gender-informed, technologically based interventions that we found in our scoping review. And then we're going to all come back together talking about this final section about ideas and resources for how we can all bring this into our work. So I'm going to start with set the stage for considering gender-informed interventions on substance use in the virtual environment. I'm going to start by speaking about some core concepts about sex, gender, equity, and substance use. So we know for sure that sex and gender matter a lot. They're among the most influential of the determinants of physical and mental health. And these two institutions, the Institute of Gender and Health from the CIHR and the Status of Women Canada, have both produced some really excellent resources that both discuss sex and gender and give guidance on doing sex and gender-based analysis. So how do sex and gender matter? It matters that we understand how the sex-related factors affect health and how gender roles, relationships, norms, power imbalances, and identities affect individual experiences and access to resources. So you can see here a bit about the sex-related factors, including all those elements and the gender-related factors as well. But, you know, there's still so much research that we need to accumulate enough about sex and gender-related evidence on health effects, inequities, treatment, and policies. So, you know, in relation to substance use, there are some ways that sex and gender matter. And we, you know, have just captured it here. That was described in a grant call from the NIH a number of years ago. And they summarized it in these 5 ways about how it matters. In sex factors like the mechanisms and the differences in the biological responses to substance use. It matters in the consequences and impacts and all the ways in which the gender-related and equity-related factors play out. It matters in terms of the different pathways, risk and protective factors, progression, transition, and maintenance of substance use problems. It matters in how, you know, people access treatment and treatment readiness and retention and outcomes. And of course, it really matters in terms of reproduction, fertility, and parenting, and the various roles and biological concerns that play out there. So really a lot to think about. Now, the center has created some info sheets that look at, that kind of quickly describe by substance some of the sex-related factors and gender-related factors. So we, you know, went into the literature, and you can download those from our website if you're interested, about those quick summaries of sex, gender, and specific substances. Now, we've also done lots of work to try and translate that into, friendly versions of understanding sex, gender, equity, intersectionality, and substance use. And here's an example of an infographic highlighting some of these various sex, gender, and equity influences for cannabis. And so, really we see lots of health and social inequities amongst women, men, and gender diverse peoples, as well as between them. And these inequities require thought and consideration when developing resources about substance use and about intersecting issues like intimate partner violence. So really important to consider all the intersecting social, cultural, and economic factors that affect health, as well as poverty, disability, sexual orientation, income, housing inadequacy, violence and trauma, caregiving burdens, family roles, power sharing, etc. So it's complex work. And we have spent some time trying to think through this, trying to recognize not only how we need to understand sex, gender factors and influences on substance use, but how to apply these concepts and issues in our work. And to really recognize how this is a choice. We can choose to be gender blind or gender sensitive or gender specific or gender transformative. And, we really see how the federal government is forcing thinking about this through requiring sex, gender, and equity-based analysis in our work. And this particular document on the screen here is one where we have tried to take some of what we know about sex, gender, and equity and really help people integrate this evidence into practice by answering 10 key questions about sex, gender, and substance use. So we encourage you to have a look at that. But within that document is this framework for understanding the integration of sex and gender issues. And you can see it starts from a kind of a gender unequal, gender blind then through to being gender sensitive, acknowledging norms, but not really doing anything other than acknowledging, being gender specific, acknowledging all aspects of sex and gender, and then considering how to do gender specific interventions. And then what we're going to talk a lot about in this presentation is really thinking through this end point here of being gender transformative. So moving to really address the causes of gender inequities and to be thinking about how we can transform harmful norms and relations as a means to better health outcomes. And, so in this session we're doing today, we're really focusing on the gender piece, but I included this wonderful slide from Women's Health Victoria in Australia because I think it really shines a light here on how we always need to be thinking about multiple things at once. And even as we're thinking about sexism, we can also be thinking about how other isms play into the story, and to be really conscious that today we're focusing particularly on the gender informed part, really feeling like we need to understand gender and sex as we work on these issues as a precursor, as a foundation to being able to do the intersectional work. So, beyond tailoring substance use programs to accommodate gender, we're really thinking today about how we can be transformative, how we can focus on both gender and equity and substance use and violence as a means to health improvement. So that's the task today that we have. And I'm just going to give two quick examples about being gender transformative today. And this one is a Canadian example that happened in the caring campus project where young men on campus came together to really think about how to address alcohol-related issues, and at the same time, they challenged masculine norms about substance use, alcohol use, mental health, and sexual assault. As they were thinking about preventing extreme drinking. So you can see there was one example of a project called For the Boys, one called Man Up for Mental Health, and one called Pro Social, all of which really address both gender equities and particularly masculinity, changing traditional masculine norms, even as they were working on substance use issues. And the second example is one from the US that is by the True Child Group, who've looked at addressing gender norms as fundamental to improving health and social justice incomes for people of color, of all genders and sexual orientations. So that's my whirlwind trip through, sex and gender concepts and a quick framework for applying gender-informed approaches. So I'll turn that over to you, Lindsay.
Thanks, Nancy. Definitely not an easy task to do within 15 minutes. So Nancy set the stage in talking about sex and gender and why they're important. And before we go into Julie, who will be bringing these ideas of sex and gender together with technology-based substance use interventions, we just wanted to provide some examples of what technology-based substance use interventions actually are. So technology-based interventions run the gambit from being websites that provide information to computer games and phone apps. And because of their wide reach, they really are a great opportunity for prevention and health promotion interventions. And with the increasing emergence, particularly right now, it's so important for us to think about how sex and gender fit into the development patterns of use and adoption of certain platforms. And we have the opportunity right now to think about how these interventions can be gender transformative in the way that they promote gender equity at the same time as improving health and promoting recovery. So this example is from Alberta. It's a text message intervention. And what that means is that individuals would text COVID-19 or would text COVID-19 hope to subscribe. And for 3 months, they would get text messages from mental health therapists that provide advice, encouragement, for healthy personal and coping skills. And we're also seeing examples of this from the anti-violence field. So Interval House of Ottawa, for example, has started a text message service because they realized that phone-based interventions or ways that people were connecting over the phone weren't necessarily the safest option right now. And so individuals who would like to reach their services can text them and receive support that way. We also see a lot of mobile phone apps. Saying When is one example in Canada. It was developed by CAMH based off of their evidence-based Saying When program and booklet. And it includes in the app a self-assessment tool, allows people to set personalized goals, talks about the standard drink sizes so you can see that example in even the cover photo for the app, and offers tip for success and check-ins in an anonymous fashion. One thing we've noticed, particularly in app development, is that these apps aren't necessarily being created by those that work in the health or substance use fields. And so this guideline was created this past year, recognizing that pregnancy apps are the most commonly used health apps. And it provides ideas for app developers who may not be working in this field on how they can integrate evidence-based gender, trauma, and equity-informed messaging. And it was developed between the Canada FASD Research Network and 2 pregnancy app developers as an opportunity to bridge the 2 fields together. We also see a lot of web-based support, whether it be information available or brief interventions. And so Dads and Gear is one such example. It's a program in BC for new and expecting fathers, and it was actually created as a mechanism for support for pregnant and parenting women to reduce their own smoking by involving heterosexual male partners in preconception and parenting. And so all of the information on the website is available, and it recognizes how masculine gender norms in smoking interplay with smoking cessation, and allows men to rethink their relationship through videos, quizzes, and other information. And then also offers in-person opportunities. So Dads in Gear Indigenous combines everything that's available, the quizzes, information, videos that are on the website, with an in-person culture-informed group-based program. And a lot of these interventions are multi-pronged. So maybe you'll see them on a website, but you could also have text-based information. So Wellness Canada, or Wellness Together Canada, offers tech support, web-based information, and counseling through various medium. And so those that would like to access mental health and substance use support can access the intervention in whatever way is best for them, whether it be by phone, by video, just visiting the website, or text message counseling services. And lastly, social media. Of course, social media has just had such a prevalent a role in our lives right now. And we're seeing an increased use of social media as a tool for web-based information. Often we see it, like Facebook, for example, as a community place for people to get social support. But we're also starting to see it as a recruitment tool in health research. And so this is a campaign that we actually released this week as part of a study on vaping, cannabis, and nicotine during pregnancy and postpartum, and really thinking how social media can be used in opportunities that are non-judgmental and supportive, and creating communities within. So Julie, I know that was a very, very quick whirlwind, but I think Julie's going to walk us through what all of these ideas that Nancy and I have prefaced with, how they get brought together now.
Thanks, Lindsay. Yeah, so turning to kind of how we combine the concepts of sex, gender, and equity with these technology-based interventions, I'll start with some examples from a narrative review that we did, originally derived from the scoping review that Nancy mentioned earlier, related to integrating and measuring the effects of sex, gender, and substance use. So we looked at this specifically for technology-based interventions, and kind of to just get a sense of what was available, what worked, and what were some of the considerations that folks were taking and when it came to technology and gender and sex. So the first example we have here is a web-based intervention primarily. They also had it available as a CD-based intervention for those that didn't have access to the technology. And this was a narrator-guided program focused on women and mothers together, so kind of a relational approach. And it focused on narration, animation, graphics, as well as activities. And it incorporated a lot of gender-specific risk factors for substance use. So looking at relations to girls' risk for substance use related to increased risk of low self-esteem, increased risk of stress, and higher levels of depression compared to boys, as well as telescoping effects. So the effect of girls progressing to heavier use after initial use. So taking some of these considerations into account, the authors tested this over time and in different contexts and found pretty favorable results for the intervention. So the next one is a targeted web-based messaging program. So this is focused on, for example, something like websites or social media posts targeting specific messaging towards youth in this case. So this was a study based out of British Columbia, and they focused on gender and culturally specific informed messaging. And again, the results here were favorable to these specific groups. For example, Indigenous boys and girls involved in the study were more likely to agree that secondhand smoke increased risk of breast cancer compared to the control group. And girls in the intervention group were 14% more likely to agree that exposure to secondhand smoke increased their risk generally. Same with 52% were more likely to request additional information on these topics. And boys in the intervention group generally were 10% more likely to agree that girls' exposure to secondhand smoke increased their risk of breast cancer. So overall results focused towards more understanding exposure, and something that we found often was that girls in particular were drawn to these education-based technological approaches. So the next one we have is a computer game example. So slightly different from the web-based programming in the fact that this is kind of a video game simulated activity. So in this example, it was tested with a group of veteran men in outpatient substance use treatment. So the participants would make daily decisions to support the recovery of a simulated character. So it was designed to address coping skills in high-risk environments. And some considerations that the authors took into account are the context of the men that they were working with. So it was an older demographic with an advanced level of dependence. Many were not in housing and most were unemployed as well. So some considerations here for in terms of access for a real life kind of simulation of this versus the controlled environment, but to keep in mind that they took these things into account and again found favorable results for this type of format, which is something that could potentially can be compared to other online support groups or finding interventions online that would fit for them that might not work as well as this type of format. So the next one is the mHealth app version. So this is something just in general in e-health that is becoming very popular and in terms of having on phones and being able to track progress. Other things include, step counters traditionally, or kind of monitoring your general health. So in this case, it was with women, and the authors took into consideration a lot of factors related to women's health and smoking. So for example, lung cancer being a leading cause of cancer death among women and smoking causing about 8% of COPD deaths among women. And also taking into account that women are likely to use these type of interventions as well to seek out health promotion. So this was specifically targeting one of women's barriers to access smoking cessation opportunities, which is related to weight concerns. And again, the authors here took this into consideration and putting in a health promotion focus as opposed to focusing on gender stereotypes as their approach here. And so the last one is text messaging. So this one is an alcohol brief intervention for men and women in college campuses. And the authors evaluated a text messaging intervention as a booster to an in-person alcohol intervention as well. And this was an interactive Panther track program, which was a two-way text messaging system. So authors sent out text messages on Thursday and Sunday to provide tailor-related messaging. And with this, they found that the men had a kind of more favorable approach to this in terms of the goal setting. So once goals were set, men were more likely to reduce their drinking. And so the last one is just kind of a summary of what we found. So although these are some examples that have favorable outcomes, a lot of them didn't necessarily have gender transformative approaches. They integrated gender specific or gender related risk factors into their considerations, but there is definitely opportunity for this sort of more tailored programming. And so this slide here, just to go over some of the considerations of privacy, confidentiality, data, connection, and usability, and taking these into account when we're looking at the substance use programming. So there's concern surrounding the collection of data by mobile technology, And both women and men have expressed concerns pertaining to how their private information will be used and communicated with. And these concerns are reflected in how individuals use technology-based programs. So for example, women have expressed reluctance to share their information, viewing phone delivery programming as too impersonal, while younger men appear to be more inclined to share this information. So another example to mitigate this is participants have been shown to have interest in having both web-based and in-person options available. So in the context of intimate partner violence, which we'll get into a bit more, there's a lot of implications that definitely need to be taken into consideration to mitigate in terms of privacy, safety, and anonymity. And there are a lot of ways to reduce these risks, including password protected websites, incorporating quick exit buttons, and incognito mode, just for a few examples. But I think it's important to keep in mind that while we do need to respond and mitigate these concerns, survivors are using technology to seek out resources and services, and it's important to not distance ourselves from these programs and to further isolate victims. So to keep in mind of how we can manage these risks and looking at them from a gendered perspective. Over to you, Lindsay.
Thanks, Julie. So just thinking ahead, what does this all mean in the COVID context and beyond? In many ways, COVID has forced us to take better advantage of what the online space has to offer us. So we've seen an influx of infographics, such as the ones from the Mental Health Commission of Canada and the Canadian Centre on Substance Use and Addiction, that's at the top, which offers strategies and even a diagram on how to conduct a square breathing or box breathing exercise to help calm your nervous system. And then we also see it from the anti-violence field with the one at the bottom from the Center for Research and Education on Violence Against Women, which has 3 considerations for supporting women experiencing IPV during COVID-19. But we're also seeing the emergence of apps like My Plan, which is a Canadian app to help those experiencing violence to understand their risks and also find resources that support safety planning, decision making to their own experience, so fitting into their own personal needs. And as we've continued through this work, we've found that there are a lot fewer tech-based interventions that have been used in the anti-violence sector. And Julie touched on this a bit and provided reasons why, as well as opportunities for forward thinking. But what we have also seen in our most recent rapid review, which was looking at substance use, intimate partner violence, and COVID-19, we saw that the efficacy of technology-based interventions, particularly in the anti-violence field, was comparable or more effective than in-person counseling sessions, and that technology really could be used as a tool to increase referrals, connect to social supports, facilitate discussion in a way that women felt was safe to them, and increase access to those that may not be able to go into in-person services because of geographic barriers, time, ability, capacity to leave the house, particularly with stay-at-home orders in place. And so having tech-based interventions is really an opportunity to empower victims and survivors, equip them with the tools to have safety plans and collect and record evidence of abuse or violence in the home. And one thing we were also really able to see is the ever more important interconnectedness between these areas of substance use, intimate partner violence, mental health and wellness, and trauma. And so we need to be thinking about these concerns together. We need to be bridging these fields together, and that we have to think through how these areas can be looked at bearing these common principles in mind. And so really today we're talking about a select few, we're talking about equity oriented, we're talking about gender informed, and we're talking about empowering approaches, but that these common principles should be used and integrated um, in all of these areas of concern that are interconnected. And so how do you create that sort of information that leverages off of those common principles and these ideas of being equity oriented and gender informed? And this was one example. This is an infographic that was created by What's Your Cap at the University of Saskatchewan, and it was designed to empower women to question the alcohol industry's gendered marketing approaches that promote alcohol consumption by women by linking consumption to attractiveness, sexuality, and relational success. And this is a really important infographic for so many reasons. But one thing that we've been finding over the years is that other interventions on college campuses where they are geared to a particular gender audience mostly have focused on women's alcohol use and sexual decision making in relation to gender based violence. And so they're not looking at men's alcohol use and sexual decision making. And this infographic shows an example of how we can create interventions that are empowering and seek to address inequities, in this case, the ones that are being perpetuated by the alcohol industry. This is another example of how we can have gender transformation in tech-based interventions. This is Heads Up Guys. It is an online intervention that engages men in thinking about mental health and addresses masculine gender norms about asking for help. And it offers supports and ways for men to connect with one another, discuss fatherhood and caregiving. And the last example that I'm going to focus on here is not a tech-based intervention, but really shows promising opportunities. Promundo has continued to do excellent work with men in the areas of fatherhood, sexual health, emotional health, substance use, and violence, and recently actually released this report here at the bottom that focus on masculinity and COVID-19 and how men are currently navigating risks related to COVID, trauma, grief, loneliness, the gendered effects of the pandemic, and how forms of masculinist leadership, which may focus on dominance, can exacerbate conflict and undermine equity efforts in human rights. And we wanted to end off with this example because, as I mentioned at the top, a lot of the interventions that have been created that are web-based haven't necessarily been created by those that are working in the field. They aren't necessarily by those that are working in the substance use or health fields, particularly when it comes to app development. And so something like this website and the resources that have been created by Promundo can be a grounding opportunity for those that are looking to develop gender transformative tech-based interventions, and really a way that we can propel forward, bringing all of these ideas together.
So we've really tried to bring a lot of really interesting examples to you, and that has really been part of our mantra at the center, is to be appreciative of the work that's being done and also to invite people to think further on sex, gender, and equity issues. And I just wanted to acknowledge as we wrap up here that, you know, you will also very likely encounter resistance to as you try and integrate gender equity initiatives within your work. And it's really important, I think, that, you know, we recognize resistance and we really think about how we can engage with it and counter it in many ways. And when I was in Australia last year, I had the great great privilege of presenting in a workshop with these folks from Vic Health, who created this wonderful resource on strategies to respond to resistance to gender equality initiatives. And I really encourage you to look it up because it's got some wonderful ideas in it to really help us think through what are we seeing, how do we bring forth some good encouragement and counter arguments to that resistance. So here we are back at the framework we provided around the integration, and really invite the question here for you about how might you incorporate sex, gender, and technology considerations into your work and move along the continuum to not only be gender sensitive or gender specific, to really think about how we can be addressing gender equity and other forms of inequity, even as we're working on health and violence related issues. And so, you know, we've seen today that there's been some research conducted on the effects of sex and gender on substance use. And we've really seen that there's research on technological approaches to substance use prevention and health promotion. And we've really seen that it's clear that there's openness to technology-based interventions by men and by women. And so now I think more than ever in the COVID context, there's a really amazing opportunity for us to partner with technological platform designers to really think about increasing the use and the reach and the effectiveness of health promotion and prevention and brief interventions that can take place in the online or virtual environment, and really take into account and advance gender equity, even as we're working on these specific issues like substance use and partner violence. And so I guess we really just wanted to end by saying that we see that service providers and researchers and policymakers can really act on incorporating gender equity as a means of improving outcomes. And we really encourage all of you who've attended today to take this up and to take advantage of the technological platforms that we have before us.
Okay, thank you so much, Nancy, Julie, and Lindsay, for that wonderful presentation. So now we'll get into our question and answer period. So if you have any questions, please feel free to drop them in the Q&A box at the bottom of your screen there, and we'll try to get to them all before 2 o'clock. So our first quick question, someone asked, what is the name of the Australian resource to counter resistance?
It's called Encountering Resistance. And I guess I didn't put the link on the slide, but I'm happy to do. It's at vichealth.vic.gov.au, but really easy to find, and just a great resource.
Thank you so much, Nancy. Our next question we have coming in, what virtual health guidelines do you suggest to promote equity?
Wow, that's a big one. You know, I guess what we tried to do was to show where some of the guidelines have really been put in place. And Lindsay and I worked on the one for pregnancy app folks that she showed in the earlier slide. So we really, you know, created that whole document to try and support the folks that were designing pregnancy-related apps to think about gender issues. So I'm not sure that there's one virtual health guideline that I could name, but I think a lot of us have really tried to think through this, and our very thoughtfulness today about gender equity, I think just says, think about, what are the equity issues, the barriers, the various things going on, and consciously think about how can we design to be able to overcome some of those. And, in the recent thing we're doing that Lindsay also mentioned, the recruitment for women who have vaped in pregnancy, we felt it was really important to use social media as a recruitment strategy, because it's not that easy for women to necessarily say, oh yes, I vape cannabis while I was pregnant in the postpartum period, because of the tremendous stigma towards women who use substances in that context. And so we really felt like here's an opportunity to find a way to let technology help us reach women and to really encourage them to join us in the study in a way where they can really recognize that there's not going to be judgment here. We really want to understand, what do you see as the benefits? What do you see as the harms? What do you see? What did you use as a vaping device? Why did you use it, and did you find it helpful, etc. So I just think that there's so many things for each type of technology that we can be thinking about good practice in, and then think about inserting gender and other equity concerns within those.
Maybe just to add on to what you were saying, Nancy, I think that thinking through the common principles actually acted as the guidance for, at least the guidelines that we worked on with CanFast. But I think a lot of the promising practices are based off of these values. And so I maybe would encourage seeking out guidelines where you do see that value space, where you do see this encouragement to be evidence-based, to be trauma-informed, gender-informed, to be culturally safe. And I think that would really help in propelling the work forward, because as Nancy mentioned, all of these guidelines are so disparate, taking into account different fields and different technologies, that there isn't just one, but that if you're guiding with values, you probably have a pretty good baseline for where to start, and then how we can build from there.
Thank you so much, Nancy and Lindsay, for your great responses. We have a couple questions in here, kind of along the same vein, talking about equitable access. So what are some recommendations for reducing barriers for folks who might not have access to a phone, computer, or the internet, etc.?
Yeah, I think something that we definitely are trying to emphasize here is that technology shouldn't replace in-person options as well, and that this can work in tandem with them when necessary. And yeah, to work around which type of access you're working with at the time. So like Lindsay was saying, to be starting with what type of technology you're working with that fits with the demographic that is using the intervention, and figuring out which variety works best. So that could be a combination of an app and in person, or a website, or the one example that we gave earlier was having the web and CD version as well for those that didn't have access to the internet. So kind of just adapting where you can and keeping the in-person options available as well, for sure.
And in some of the cases in the COVID context, we've been working with pregnancy outreach programs that normally have drop-in interventions for moms and babies, pregnant women and new mothers and babies, and their partners and support networks. And one of the things they've done in the context of COVID, when there hasn't been able to be the opportunity for coming together face to face, is actually to deliver phones to the women and have weekly phone interventions and support calls by offering the phones. And I know in Saskatchewan, in Prince Albert, we've been in touch with the Family Treatment Center that serves Indigenous women and their children in substance use treatment context. And in the context of the COVID situation, they also did weekly phone calls to the women in their, and may still be, I'm not sure where the situation is in Saskatchewan right now, but they actually involved the local treatment counselor and women in a joint phone call to make sure there was local support for the women as well as that couldn't come into the treatment center. And it was a super effective way, and actually they reflected that it really improved their relations with all the referral agents as well as the women themselves, to be able to stay in touch using just the simple cell phone technology. But yeah, lots of things to think about. What are the barriers? How do we think through in each case what is going to be the best possible way of reducing barriers to access?
Thank you so much, Julie and Nancy, for your responses on that question. So the next question has to do with privacy. So how do we mitigate privacy concerns with these apps?
So again, I think it kind of depends on the context. We gave just some examples in relation to intimate partner violence and mitigating these concerns with quick exit buttons and things like that. Other examples with that are also not using abuse-related language in the app itself or as the app's name, which can be similar with addiction-related language as well. And again, I think the emphasis is to work with technology and app developers and understanding, kind of having e-learning from the beginning, from the researcher's perspective and the policymaker and service provider's perspective to begin with, and working with app developers to understand what the privacy issues could potentially be and making that the forefront before it's going into those who are using its hands.
Yeah, privacy is a big issue for us all. And I'm not sure we all understand actually how best to do it. And, I see a lot of people on Facebook sharing a lot more than perhaps is safe to do. And I think that's part of our work, is really teaching about privacy, safety, and boundaries for improving in the context of improving our health. So it's a really interesting time, and I'm not sure that we really have the answers around the privacy thing at this point, but we sure are interested in continuing to read about it and think about it. And if any of you out there have some great resources and thoughts about it, please type it in, because it's a really important question.
Yeah, and I think to add as well, working from the ground up with that and working in the development of the app itself gives you a lot more control over those types of issues, as opposed to putting it on a platform that already exists. So again, just coming back to e-learning and being involved in those interventions from the beginning.
Definitely. Thank you both. And maybe we'll get to one last question before we go into our wrap up for today. So do you have any suggestions for gathering gender-based data from youth in a respectful and appropriate way?
We do. We could do another whole webinar on that. It's so important, eh? to be able to be thoughtful about how we do that in a way that doesn't, and I guess that's part of our whole thought today, is we want to attend to gender and sex where, you know, there are health implications that are sex related as well. But we want to attend to those things, and yet we don't want to reinforce sort of traditional gender stereotypes. We really want to advance equity as we're doing it. So it's a really important challenge for us, and one we spend a lot of time talking about at the center, and, you know, would love to engage with who's ever asked that question further about what that could look like, because I think it's the question, really.
And might also encourage, CPHA released new data capturing, mostly for surveys, but about race and gender. So recommendations that are now being adopted by Statistics Canada, and they really implored what they would be looking at in terms of equity analysis when it comes to gender, race, ethnicity. And so if you're thinking about it in a more categorical sense, in terms of like getting demographic data rather than creating responses, I would definitely encourage looking to that resource.
Thank you so much. And just super quickly before we get into wrap up, someone's asked if you would be able to provide a list of the websites that were used in your presentation.
We sure could.
Okay, great. Thank you so much. So we'll go into our wrap up for today. Thank you so much to our three amazing presenters for your very informative presentation. I know I definitely learned a lot. The contact information for our presenters is listed here. And thank you to everyone for attending today.